Welcome to Startup Health Now, the weekly webcast that celebrates the healthcare transformers and changemakers reimagining healthcare. My name's Unity Stoakes, and today we're having a conversation with Margaret Laws, the president and CEO of HopeLab. Margaret is a great friend, was with the California Healthcare Foundation for many years, and really one of the gems who helped get Startup Health off the ground. So very excited to be speaking with Margaret again today. Stick around, it's going to be a great show.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. Well, I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
So Margaret, it's great to see you again.
Great to be back. Thanks for having me.
Congratulations on your new role at HopeLab. Thought we'd just start off with a little background. What is HopeLab and what's the mission of HopeLab?
Absolutely. Well, I'm really excited to be here in this new capacity. So I took over as CEO of HopeLab in early July. And HopeLab, just by way of background, is an organization, a nonprofit. It's an operating foundation, actually, started by Pam and Piero Midiar, the founder of eBay, and his wife. And it was started, actually, with an idea that brought together technology and kids and young adults. And the idea was hatched by Pam Midiar. She was working in a lab, working with kids with cancer, and she was also a gamer. And she was really interested in the potential of using a video game to try to help kids with cancer and to try to solve a problem that they were discovering with these kids, which is that they would get into remission and they would need to take chemo drugs for a couple of years, and they weren't taking the drugs. And the project that really first launched HopeLab became a video game called Remission. And now Remission and Remission 2 are both out there on the market. So Remission was the first of a series of efforts that have kind of defined HopeLab, which is really using technology to try to improve health and wellness for kids and young adults. The first Remission was a game.
So it started just with that little...
Started with a spark. It started with this interest that Pam had and this idea that this might be powerful. And it turned out that the punchline, which I think you know and hopefully many of the listeners know, is that it turned out to actually be very powerful. HopeLab is a research-based organization, so there was very, very rigorous research done on the intervention. And it was demonstrated that the kids who were participating and playing the remission game were actually having much better outcomes, much more adherent to their drug regimen than the kids who weren't. And they did fMRI imaging, brain imaging studies that showed a big difference between the way a kid's behavior changed and the kid interacted playing the game versus just receiving the information passively. So if I'm the doctor telling you, just Unity, you've really got to take your meds because we don't want you to relapse, it was very, very different activity in the brain than when you were playing the game, attacking the cancer cells, using the chemo as your sort of weapon in participating in kind of your own care. So really interesting insight. And the lessons that were learned in Remission were taken into HopeLab's next project, which was the development of a physical activity. Initially, the idea was to work on obesity, and the notion after crowdsourcing, actually a competition of ideas, was that the most powerful way to create something to work on obesity was to work on increasing levels of physical activity. So Zamzi was created.
This was the second platform?
The second platform. Zamzi was created as an effort to get kids to be more physically active and get all kinds of kids, but particularly low-income kids and kids who are at risk of sedentary behavior. So some really interesting work done to look at, for instance, tween girls who were the most difficult people to get physically active, and to develop things that would work really across a wide range of young adults and adolescent kind of tween kids. So Zamzi similarly was based on the research from the Remission game on this sort of recipe, this idea of starting with a desired behavior change and then working back to create an experience, to create a technology intervention and an experience using, deep human-centered design principles that would help achieve that behavior change.
Yeah, what's interesting there is it sounds like there's almost a mashup of a lot of very powerful things. You've got research as a foundation, but there's also technology innovation, there's design innovation. Is that part of the core philosophy to integrate those different aspects?
Exactly. So HopeLab's a pretty unique organization. So when we describe what we do, who we are and what we do, we combine rigorous research with human-centered design and product development or partnering with others who develop products. We have, I think, a deeper psychology-based, behavioral psychology-based design intervention than many folks who are doing design. Not completely unique, but I think putting all those things together, and I think importantly, putting them together from a philanthropic organization. So we're actually going out into the market looking for places where we think there's opportunity to have huge impact. We're able to bring these resources to partnerships and organizations in a way that we hope will impact really diverse populations. So we're looking to...
And is this all over the world or mainly in the U.S.?
It's mainly in the U.S. HopeLab has done a little bit of work internationally, but the main focus of it is in the United States.
Great. Well, one of the things that I think is really we focus on with a lot of startups, but I think would be an important maybe lesson to share is the power of having a big mission as your foundation. How have you guys leveraged that or focused on the mission as sort of the core starting point for what you're doing with remission and Zamzi and maybe some of the future things you're working on?
That's great. Well, it's a great question, and I feel very passionate about this, and I've been trying to sort of think about how to bring a mission focus together with early stage companies and capital, and think about taking on big, risky, audacious projects, and the work that I've been done in the past and the work that I'm doing in HopeLab. And I think HopeLab started with this big idea. Not that crazy an idea that technology and kids could be brought together, and that technology could be a powerful agent in helping improve health and wellness for kids and young adults. But one of the things that's interesting is that we have a couple of generations of kids now who are digital natives, and there hasn't been a lot of work done on how we can we talk about it as using technology for good, but how we can use this technology to really amplify and improve health and wellness for kids and young adults. So HopeLab has that big mission, and a big mission of really trying to work in new groundbreaking areas of scientific research. So we've maintained a real focus.
So it starts with that kernel, on the research kernel?
Exactly. We start with the research kernel, and the work that we do really, and the partners that we want to work with, really do have to have that commitment to the research and to doing rigorous research on demonstrating the efficacy of these interventions. And then I think that's a big piece of the big idea. And then I think the other big idea is that we can, through deeply thoughtful human-centered design, really design and test interventions that can help people change behavior in a positive way. And I think one of the things HopeLab's able to do, because again of the philanthropic nature of our work, is we can be a little more patient. We can take more time. We can do more cycles of iteration, and we hope we can also take on riskier areas that we don't know as much about. So over the past few years, HopeLab's been doing work in social emotional learning, in working with programs in college campuses to help reduce college-age suicide, and to try to kind of step back and think about what kinds of support networks and what kinds of interventions we might help create or scale that can really help tackle some of those big challenges.
That sounds like a huge mission. What does success look like as you look out over the years? If you could sort of wave a magic wand, what would you like to achieve, I guess, if as you guys keep building these successful programs?
Yeah. So I think one of the interesting things about our mission and what we do, and I think it is, you talked about it as a big mission, we're really bringing together a strong interest in impact and scale. So from our funders, from our founders, a strong interest in impact and scale, and a very, very strong interest that I would say in sort of improving the human condition and in really improving wellness. And so juxtaposing those two things is a really interesting challenge. It's a particularly interesting challenge for me. But I think if we're really successful, what we'll be able to do is find opportunities where we can, using technology, using human-centered design, using this array of tools that we talked about, where we can really amplify impact, both at the individual human level. We can help develop things that really have an impact on health and wellness, and we can do it at broad scale. So we can find opportunities that I think, you and many of the startups you work with, and we think can use technology as an enabler to much more massive scale and to much lower cost. And so we're trying to find some interventions and some intervention opportunities where there's evidence base, and there may be opportunities with an evidence-based intervention or treatment to get it to many, many more people.
And it may be in one pocket now or sitting on a shelf somewhere, but if you can open it up or use technology in a new way, you can really scale it to everyone.
Exactly. So you think about, as you know, one of the companies that I've worked with a lot in the past is Omada. And Omada took the diabetes prevention program, an evidence-based protocol, and brought user-centered design, human-centered design, and technology tools, and networking, and peer support, and coaching, and a lot of the things that didn't exist when the initial intervention was developed. And by bringing together that interesting combination of new tools and technologies and a digital platform, we're able to reduce the cost dramatically and to make it much more convenient and available to lots of people. So, when we think about the areas where we feel like we can have impact, we want to try to find opportunities to bring this sort of unique combination of tools to evidence-based interventions that we could, by working on them, getting them better, faster, cheaper, more accessible, get out to and available to many more people.
So what will you be looking for in the future? What's the future look like?
Okay, so one of the things we started with when I came in was we decided, HopeLab's been around now for 13, 14 years, and we decided it was time for us to kind of go back out to the market. And if we want to have scale, we need to be working where the market is interested in working with us. And so we've been talking to children's hospitals, we've been talking to Medicaid managed care plans, we've been talking to commercial health payers and providers, we've been talking to in the education space, to education technology and curriculum developers, platforms, and really trying to understand if we want to work with the market where the market has seen needs and really wants to meet those needs, where are some of the most important areas? And so far, just sticking with health, since we're in startup health today, what we've learned from the Medicaid market is that the time around birth and early childhood and teen mental and behavioral health are two areas where those payers and providers see the opportunity to improve care and reduce cost. And so those will be areas where we'll double down a little bit over the next year or so and look for big opportunities where we think we can contribute to that goal of improving care, improving outcomes, lowering cost, and where we think there will be great partners for us out there in the market. So we're looking to work with partners who we think of as sort of distribution partners, partners that have patients, that have people they're working with. We're looking for partners in technology. We really work through a model where we're trying to bring a set of skills and assets that we have, but to find places where there's potential for big impact and they're really motivated, interested partners in the industry or in the field.
Yeah, so you have this interesting collaboration with Welltok that I think would be really interesting to talk about.
Fantastic. So one of the challenges, I talked a little bit about the development of Remission, and Remission was an experiment for kids with cancer, relatively small market. When we went into the development of Zamzi, we were looking to target a really big market, kids who need to engage in more physical activity, which is a lot of kids. And one of the big challenges we then faced, we're a organization that sort of prides itself on experimentation, was how we could do something that would actually scale much more broadly. And the idea of trying to take this product out to the market, commercializing and marketing a product was not something HopeLab had done or actually had the skills and abilities internally to do. We made an effort at one point to spin it out and raise money. That wasn't successful, brought it back in, reverted.
It's almost a startup within.
It was,
within
yeah.
HopeLab.
It was a startup having all the experiences of a startup within
Right.
HopeLab, including which many similar startups had. We brought it back in, and we're running it as part of the nonprofit HopeLab, and began thinking about how could we find a partner? How could we find someone that could help us commercialize it, that actually had the skills and capabilities and platform to commercialize it? And maybe one of the other insights we had is that maybe actually this was a product, not a standalone company. And so we talked to a number of different companies, from health plans to healthcare providers to a couple of platforms. And it turned out that Welltalk was actually interested in the potential of acquiring the product and then working with us to integrate it into their platform. And so we made a deal with them to actually have them do the acquisition and basically take over the running and maintenance of Zamzi, but that we would actually work with them as HopeLab to do a couple things. One, to integrate it onto the Welltalk platform, and second, to continue to do research and potentially even to develop additional features and functionality if that seems like it makes sense down the road. So for us, it was just a really interesting, I guess to your point, it was a really interesting way to go through the life of this startup and to find the place where it really could potentially go to scale and get out to the market.
It seems like a great model for how to scale and how you can scale other initiatives in the future as well.
Absolutely. And I think, we're constantly experimenting. So I think the lessons that we learned in Zamzi, we hope will inform what we do going forward, and that we'll think differently based on what we've learned, both about the market and about all the different potential partners there are for us out there. And one thing I always say, you hear me say this a lot, is that I feel like there are a lot of very mission-aligned partners in the commercial market. And I think if we're looking for those, even though we operate as a nonprofit, we're a very mission-based organization, I think we find more and more that there are very mission-aligned partners. And so we can go out and look for partners in an area like maternity or early childhood or teen mental and behavioral health, and there's a huge amount of interest and potentially very aligned partners for us to work with.
So why was Welltalk interested?
It was great. It was actually a really, it's one of those fantastic conversations where I started having the conversation with Welltalk, and they said, we have actually been looking for and spent the past 6 months actually thinking about how to find where we might find a kid-focused product that we could integrate, because we believe that we need an offering for the entire family. And it turned out that timing was great for us, that we were looking and they were looking, and they were looking for what we had. And our philosophies about the role of a product focused on kids, but focused on kids to actually engage the whole family, were really aligned. So we both had this hypothesis, which we'll test and we hope is right, that as we get kids more engaged, we'll get parents more engaged. That's the experience we had with Zamzi, and I think that's the experience they were looking for, is they go out to the market with a product for families, having something that is a focus on kids and is really resonant with kids and relevant to kids and isn't sort of just the grown-up version of it for the kids to use, would be something that would be appealing and would actually help them with their broader mission. So it was a great fit for us and good timing.
Are you ready yet for startups? Can innovators get involved in what you're creating at this point?
Well, it's an interesting question. I was actually talking with some other startup health folks about that this morning. I think that the way we work is we'll do the basic discovery and design work, and then begin to think about what the solutions are. And then we go out to the market and we look at the solutions that are already out there. So I think as we begin to work in some of these targeted areas, and we're looking for solutions, for instance, some of the work that we've been doing on social emotional learning, or on kind of mood regulation and those sorts of areas, we've actually gone out to the market and found either researchers or people with very early stage, I don't know whether we call them startups yet, but early stage ideas or researchers, and really worked with them to build out what they're working on. So I think that there will be potential down the road for us to work with some companies that are in these spaces where we're working kind of as co-developers, or potentially bringing them into projects that we're working on. So we're excited about that. And I also think we're trying to do some things over the course of the next year or two where we we try to see what opportunities there are for us to convene or to really understand and help others understand the space of digital health for kids and young adults much more clearly. And so thinking about organizations like Startup Health, where you guys are tracking development of what's going on out there in the field, thinking about ways we might partner to sort of get more visibility and to understand where there are opportunities to connect some of these early stage companies and ideas to the market. Certainly something we'd like to keep an eye on.
It's such a big opportunity. I mean, kids and youth today, everyone, even around the world, has access to digital tools and technologies, and I think it's a huge opportunity. So it's wonderful that you guys are focusing on this mission. Where can people find out more about HopeLab and follow what you're doing or get in touch with you all?
Absolutely. Well, we visit us at hopelab.org, and then we are tweeting. We're trying to be as active as we can on social media, and we'd love to have people visit the site and kind of join and sign up for updates from us. And I'll be hopefully, checking in with you guys again.
Yeah, no, we'd love to check in with you because I know you guys have a lot of exciting things in development. I'd love to bring that to the ecosystem so that we can get more startups and innovators really backing what you guys are doing. I think it's very important work.
Fantastic.
So, thank you so much.
Absolutely.
We'll see you next week. Thank you.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
It's great to be here with two of my favorite people in healthcare. We've got Michelle Snyder from Welltok and Margaret Laws, again, from HopeLab. Great to be speaking with you. So I thought we'd follow up on the conversation, Margaret, we were having earlier, and you hinted at some developments and news. You guys have a very unique collaboration. It'd be helpful to maybe talk about what that is and why it's important.
Great. Well, thanks, Unity. We're really excited. I'm excited to be back to talk about this. Actually, it's been in the works for several months now. And as I joined HopeLab earlier this summer, we were really trying to figure out the answer to the question of what can we do with Zamzi? How can we get it out to market? And as I noted earlier, we're not a commercialization or marketer of products and services. And so we began to have conversations with some folks in the market. And Michelle was one of the people I reached out to, being very wise in this area. And it turned out that her company, Welltalk, had actually been looking for something like Zamzi. So I'll let her talk about that.
Yeah.
Great. And also maybe to frame Welltalk a little as well would be helpful for those that are learning about it.
Sure. So Welltok is a health optimization platform, and a little bit about that. So basically, we've created a platform in the industry that helps organize all the different resources we're seeing now, condition management programs, mobile apps, communities, content, brings it together, creates personal health itineraries for consumers, and then helps them optimize their health by rewarding them both intrinsically and extrinsically for doing various activities or the things that are on their itineraries. And one of the things as we were putting this together, we realized that we were really focused on the individual and the consumer, whether that person came in through a payer or a provider or another population health manager. But what we realized is health is really a family affair. And you can't just address the individual. You have to think about everything that's going on in their world. And especially for most, consumers today, they're not only dealing with their own health or their spouse's health, but they're dealing with their children's health as well as their parents' health. And so we realized we had to think more broadly about our platform and think about how do we not only engage the individual, but kids and the individual's parents as well. And so we had been actually looking for a while at different companies and technologies in the market that tried to focus on children and help them address physical activity and increasing their physical activity. And I had been a big fan of Zamzi for a couple years, and then when Margaret came on board, I thought this would be a great time to talk about having a collaboration.
Maybe share a little more detail on this collaboration. So you'll be acquiring Zamzi?
We are. So we're acquiring Zamzi, and we're keeping the team right now. They're working on the product down here in San Francisco. We also have our team in Denver on the Welltok side that's working closely with each other, and we're looking forward to integrating it into our core platform and then being able to offer it to our population health manager clients.
And so for HopeLab, this was an opportunity through the acquisition by Welltok to actually take Zamzi out to the market. It wasn't something that we could do on our own, so we were really excited to find a company that was really interested in taking what we had and building it onto and integrating it with their platform so that it could get out to customers around the country.
It seems like a great opportunity. There's so many products out there. There's a lot of research and innovation sitting on the shelf at places that just needs to be unleashed. So it's really great to see this develop. When will people be able to get access, or when will it be available through Welltok?
Yeah, well, we're actually phasing it. Later this year, actually, Zamzi will be available for our clients, and then we'll be working on the full integration early next year into our core platform.
Okay, excellent. And since we're at Health 2.0, curious on both of your sort of reflections on where we are just in the industry today, sort of the state of the market. How are you guys feeling about the cycle of innovation and where things are going?
Well, it's been really interesting for me, having been here now since the beginning, 9 years in a row, thinking about at least when Zamzi came out, I think we could honestly say we were a little early for the market, and I think Michelle might say the same thing with Welltalk. And it's just really fascinating today. I was sitting downstairs at a session about thinking about platforms and ecosystems. We've been talking about platforms from sort of an investment perspective for several years, but what I'm seeing is these products and services like Zamzi actually having now ways to efficiently and kind of cost effectively get out to the market through platforms and through these bigger ecosystems of consumer health.
It seems like 9 years ago it was just talking about these things.
Yeah.
So now there's really ways for them to come to market.
Yeah, exactly. And I would probably echo Margaret's sentiments in terms of the platform. You know, when I started at Welltok, I would even say we were still kind of on the front end of the market. And we'd go in, we'd get meetings with a lot of the most innovative health plans and providers or even retail organizations. They liked what we were doing, but it wasn't ready. They weren't ready for us quite yet. And I would say just even in the last year or so, it's like all the market forces are colliding together. And so our vision of where we thought the market was going is now meshing with where they need to go as an organization and the capabilities that they need, and capabilities that, frankly, a lot of these organizations don't want to build on their own. Right. It's very expensive and time-consuming to build a platform that can integrate various different programs and data and devices. And so it's an exciting time because I feel like we're now right in the middle of the opportunity that we were seeking.
And do you think the consumer continues to gain more power in this sort of new ecosystem and where things are going?
I do. I think the key, though, will be everybody's talking about engagement, is actually designing the products and the platforms and the experience right. Because just giving people information doesn't necessarily mean they will act on the information. They have to understand what to do with it. You have to make it easy for them, or you won't see action. And so I think that, that's going to be the key, is kind of the next phase. And what you're hearing a lot about is, behavior design, right? And thinking about how you integrate extrinsic and intrinsic rewards, right? And how you keep people motivated. And so I think that's where you're going to see a lot of focus and attention going next. And actually, that's one of the things that I loved about the Zamzi platform is, one, they had amazing results in some of the studies with Robert Wood Johnson and HopeLab showing 59% increase in physical activity. And I think part of why they're able to do that is they've spent a lot of time and have experts thinking about, the behavioral science behind how you motivate people and especially kids to get active.
Yeah. And that was one of the other things that was exciting for me about a couple of the sessions here is the real emphasis on designing for behavior change and the human-centered design. A lot of the conferences and discussions I've been to over the last several months has been much, much deeper focus on, to your point, the consumer or the patient or the person and what he or she wants and needs and what it's going to take to actually help that person change behavior, as opposed to we've got a really cool gadget, We're
Right.
going to show it to you. You're going to love it.
So one last question. If you could ask all the entrepreneurs out there to be focusing on one thing today, what should they be focusing on? What would you love to see more of?
Oh, that's a good question.
Maybe it'll
guess-
be your next acquisition.
Yeah,
at
I
Welltok.
guess I would just say make sure you're focusing on solving a real problem. I feel like I still see a lot of really interesting apps and websites that are kind of cool and fun in the healthcare space, but at the end of the day, I don't know what problem they're really solving, and are they solving a problem a population health manager really has? Because if they are, those are the type of partners that we're looking to bring into our ecosystem, so we can help our clients solve key challenges that they have.
And I guess I would say, I echo that one. I think it's a really important one. But I would also say, really be mindful. The word frictionless was used a lot downstairs in one of the sessions I was just in. And every time I see something where you have expectations that the person or consumer is going to enter a lot of data, do a lot of things, take a lot of, basically go through a lot of clicks, I immediately turn off. And I think really understanding what someone's, we talk about workflow, what someone's life flow is like, and thinking about how these things fit into the day of a person and kind of what they bring to them, as well as what the person needs to do to kind of complete the tasks. I think that's really important. I think we've just seen so many things where it's an onerous task to interact with this. People do it for a short period of time and then they stop. So thinking about how you can both engage and hopefully delight the consumer is really important.
Wonderful. Well, thank you guys both for being such great leaders for the industry. It's great to be with you here today and looking forward to seeing more about this new partnership and, I guess, acquisition and what develops from it. So thank you.
Great.
Thanks.
Thank you, Didi.
Thanks.